Thank you for choosing Santa Clara Valley Health and Hospital System for your healthcare needs. For the next 10 minutes, we will review the process for financial screening. This will be an overview to help you prepare to complete the financial assistance application known as the FAA. It is important to note that to be screened for a coverage program other than Medi-Cal, one must be a resident of Santa Clara County. We will require proof of residency, such as a lease agreement or phone, landline number, water or electric bill. Please remember that this documentation will be verified. If anyone is not a resident of Santa Clara County, please see us privately so we can assist in directing you to your county of residency. If you have active health insurance coverage, Santa Clara County Health and Hospital System will bill your insurance for regular and customary charges. There are 3 options to choose from when deciding how to pay for hospital care here at Valley Medical Center. Clients who like to determine if they qualify for a health care coverage program, which provides either partial or full health care benefits, should choose option 3. Option 1 is for patients who have already applied to a publicly sponsored program, such as Medi-Cal or Medicare. Option 2 is when a client wishes to pay for all charges for health care themselves. Patients not covered by commercial or public health care insurance who do not apply and qualify for a health care coverage program will default to option 2. If you choose, the Santa Clara County Department of Revenue will work with you to arrange installment payments, which may be made in cash, by check, money order, and cashier's check. We also accept Visa and MasterCard. Option 3 is chosen by clients who do not have active health insurance and would like to know whether or not they qualify for a program which provides either full or partial financial assistance from a government agency or charity care sponsor. It is important for you to understand that we at Santa Clara County Health and Hospital System do not choose programs for our patients. Neither do the patients choose which programs they are assigned. For clients who choose option 3, there are 3 important steps to apply for a financial assistance program. Step 1. Submit a complete and signed financial assistance application. All information must be complete and accurate. Step 2. Provide photocopies of all required documentation. Step 3. Return a completed and signed FAA packet with documentation to the Patient Access Department. Remember, you can always refer to the information online or call our Patient Access call center with questions. Our phone number and web address are in the brochure we have given you. This is the FAA, which needs to be filled out completely. At the top right-hand corner, there is a space for your medical record number and today's date. All persons who have ever been a patient at Valley Medical will have a medical record number. If you know it, please write it in. If you have been a Valley Medical Center patient and do not know your medical record number, write yes. Please write NA in the space to note that the information does not apply to you. In box 3, top left-hand corner, where it says legal name, last, first, and middle, please clearly print your legal name. Now or any time in the future, if you are deemed eligible for a program, please always proactively contact us with updated information. Please contact us if any of the information noted there is different. Program eligibility changes often with any of the changes that are listed on this sheet. Clients for whom information changes without notification to us may become immediately ineligible for program coverage and may lose benefits. Also, certain changes may place persons onto a different program which may have other benefits for them. Please note the statement which must be read and signed. Without your signature, the FAA is not valid. If you come across something you don't understand, please feel free to contact our patient access staff. The required signatures at the end of the FAA attest that all information on this form be accurate and true. This form then becomes a legal document when it is received by us. All information on this form may be verified via credit check and other similar services. Please understand that the failure to intentionally not disclose all pertinent information or false information may be considered fraud. Proof of U.S. citizenship or permanent residency are required for some programs. You may need to show us an original birth certificate. It would be a good idea to bring an original of your birth certificate as well as a photocopy of the birth certificate when you are coming in to drop off your documents. We cannot accept cell phone bills or documents with a post office box or mailbox only on the address as proof of residence. To qualify as proof of residence, the document must have your current physical address on it. In order for us to know for which programs clients may be eligible, clients must submit proof of income. This includes copies of all your sources of income, which can include, but are not limited to, employment income, cash income, Social Security, disability, unemployment, rental property, child support, and assets. If you are employed, we need your 2 most current pay stubs. The pay stubs cannot be older than 45 days from the application date, the date you signed your application. The current year's federal income tax return. We need copies of documents from payment sources such as federal, state, or local governments. These include award letters from Social Security, unemployment benefits, retirement or pension payments, disability payments or workers' compensation benefits, cash income statements including tips or undeclared income, including day labor or under-the-table income, military income statements, and rental income receipts. You must provide a copy of all the listed documents that apply to you. If you are married, then we must also have the documentation for proof of income for any income your spouse has or earns. We will always match clients to the best program for which they are eligible. It is important to return this information to us as soon as possible. If you have already received services at BMC, we must receive the completed FAA and required documentation within 14 days. If you cannot turn in the financial assistance application and required documentation within 14 days, then you must write us a short letter requesting an additional 14-day extension and provide the reason for the extension. The letter should be addressed to the Patient Access Department and returned to us before the end of the first 14 days. If we do not hear back from you within the appropriate time, you will receive a bill. If you are here because you already have had healthcare services, regardless of whether or not you were granted an extension, it is important to note that different programs may have different windows of time. Patients must be approved for programs or will receive a bill. It is then in your best interest to complete the application process completely and as soon as possible, so that if you are eligible, it is completed within the time frame that retroactively covers your bill. Otherwise, your coverage may only be active from that date forward, and you could still be responsible for payment for past services. So time is of the essence. Again, thank you for choosing Santa Clara Valley Health and Hospital System for your healthcare needs. We look forward to serving you.